The rollout of the COVID-19 vaccine saved millions of lives worldwide. However, as with any mass vaccination program, researchers have been closely monitoring the potential side effects of the vaccine. And this isn't getting brought up nearly enough, as it should be, not in the mainstream media and even online. And one of the conditions that has caught the attention of researchers is postural orthostatic Tachycardia syndrome. Please excuse my pronunciation. But for short, it's known as POTS. P-O-T-S. POTS is a disorder that affects the body's ability to regulate the heart rate and blood pressure. Understanding the side effects on the heart is vital because many people felt pressured or forced to take the COVID vaccines if they wanted to continue working or just continue on with their daily lives during the pandemic. Also, they were told in confidence from the media, doctors, and governments that there were a very slight chance of side effects, or they didn't really educate or elaborate on what the potential side effects could be. Most people thought they would be okay. And even though they thought that they might not be, they still did it anyway because they really felt like they didn't have a choice, or they sort of felt like they were overthinking and there was nothing to worry about. Now, the side effects of the vaccine are coming to light, so we're going to be taking a deep dive into the potential link between the COVID-19 vaccines and POTS by looking at the findings from a recent review paper. But if you want to see where we got all these findings and our information from, just go to bearsciences.com and read our articles there. It's all there. We'll leave a link in the description below. And if you want to see more articles about the effects of the COVID-19 vaccine or anything to do with science, you can subscribe to our newsletter to stay updated with all our latest articles and become a member to receive early access to these. And if you have any questions you want us to answer in one of our articles, become a member and we'll answer it for you guaranteed. But let's get back to what POTS is. Well, POTS happens when your heart rate jumps abnormally after standing up, by at least 30 beats per minute in adults or 40 in teens, without a big change in blood pressure occurring. This can cause dizziness, palpitations, extreme fatigue, and even fainting in people. This is a condition that can severely affect people's daily lives. Imagine feeling faint all the time or constantly having palpitations. It's uncomfortable, it makes you feel uneasy, it can really affect your work and, well, just anything like going shopping. What we know about POTS is it can be triggered by viral infections, autoimmune responses, and sometimes vaccinations. So how many people were affected by POTS? The research paper found that POTS after the COVID-19 vaccinations is rare, with most cases appearing within 2 to 90 days after the vaccination. However, this paper does not mention if they focused on cases beyond 90 days. So that doesn't mean it's not possible for someone to develop POTS after the 90 days due to the COVID vaccine. It just means they didn't really look at it. Thus, it would be interesting to see the effects of POTS or other side effects from the COVID vaccine in the long term. Because right now, this paper and many others like it are only looking at the short term during the pandemic. They're not even looking at 3-4 years after, which I get, it's hard to find a correlation when it's been so long. However, it would be interesting to see not just the short-term side effects of the vaccine, but also the long-term. Because most of these vaccination rollouts were only 4 to 5 years ago, not that long ago in the big scheme of things. So it's going to take a few more years to really see if any long-term side effects pop up, any symptoms, etc. So that will be some really interesting data to see if that research is pushed forward. However, what the researchers do know that in a large US study, there was shown a slight increase in POTS diagnosis in the 3 months after the vaccinations, compared to before the vaccination rollouts. This does suggest that there is a link between the vaccines and developing POTS. But I'm sure as you remember, there were different types of vaccines from various companies, but the most reported cases of POTS being developed after the vaccinations were from mRNA vaccines such as Pfizer and Moderna, as well as the AstraZeneca vaccine. So yes, there does seem to be a correlation between the COVID-19 vaccine and developing or increased chance of developing POTS. However, it's important to note that the COVID-19 infection actually carries an increased chance of contracting POTS than the vaccine itself. One study found that the people were 5 times more likely to develop POTS from the COVID-19 virus compared to the vaccination. Thus, you're less likely to get POTS if you're vaccinated because you're less likely to get COVID-19, which seems to have, for whatever reason, a higher chance of you developing POTS from it. And this is where people really have to balance out the benefits and the negatives or drawbacks from vaccines or any sort of medication, and it all starts with transparent and clear communication, which unfortunately a lot of people felt was lacking during the pandemic. However, I do have one question for this statistic. Were they people who were not vaccinated at all and only contracted the virus, or were they vaccinated, had the virus, and then also got the POTS diagnosis, because it would be very interesting to see if this statistic involves both groups or just one. Because let's say it's just people who were vaccinated then got the virus, it could mean that maybe the vaccination still has an increased risk for POTS and the virus just triggered it. However, if it's just people who contracted the virus without being vaccinated, this does give us solid evidence that the virus has a huge factor in increasing the risk of POTS. However, this is still a hypothetical and just a question, and more research needs to be given for us to have the full answer. However, to sum it up, the research does show you are more likely to get POTS from the virus compared to the vaccine, even though both cases were relatively rare. Therefore, the health experts in this paper stress that the benefits of the COVID-19 vaccination still far outweigh the risk. But with that being said, just because POTS is rare after the COVID-19 vaccinations, these effects still impact real people and can greatly affect their daily lives and cause massive disruptions. Whether they're uncomfortable, frightened, or scared due to these symptoms at work, or the constant doctor appointments, the cost of those, causing financial stress, especially in a pandemic when many people were being let go or struggling to find work, it was very tough, and you can see why people were scared, frightened, and felt betrayed by the medical industry, their governments, and even science, because they felt like they weren't educated on this matter, or at least it wasn't transparent. They felt pressured, pushed into it, and if they at least had a choice or more time to think about it, maybe it could have been avoided. Maybe there could have been an alternative. Now, we're not blaming anyone for having or causing people to have POTS in the COVID-19 vaccines. Like any vaccines or medications, there are side effects. However, what we need to address, and what is very important, is that the general public is aware of all the benefits and side effects of the vaccinations. This provides a trusted and transparent relationship between the public, science, and the medical industry. And unfortunately, this was lacking during the pandemic, with many governments, businesses, and media outlets pressuring people to take this vaccine, and those that would question it or even be concerned about the side effects had their comments brushed away, were silenced, or were even deemed anti-vaxxers. Even though they're not necessarily anti-vax, they could have been vaccinated before, but maybe they were just concerned with the rush, the rollout, and wanted all the information, which I think is quite fair for anyone, for medication, vaccines, or anything at all, the food we eat, etc. However, again, we want to address that transparent and trusted information is important because everyone deserves to be educated. And that's why Bare Science exists, to show true science behind anything, including the COVID-19 vaccinations. There is another side effect that infects the heart, which we're going to look into soon. So if you want to stay updated with that, make sure to subscribe and like the video, but also go to baresciences.com and you can subscribe there to our free newsletter to stay updated with that article and all our latest papers. You can also become a member to receive early access to these and other exclusive perks, including getting your questions answered in one of our papers, showing the science behind it guaranteed, for the absolute steal of $2.99 per month. Because there's nothing more valuable than information being educated from a trusted, transparent source with no bias. All our information comes from scientific research papers, and we will cover any topic. Just comment as a member and we will answer it guaranteed. And we have many more things coming your way as a member. But there's still a few things we need to mention about the COVID-19 vaccine. Well, how severe were the POTS cases after the vaccination? Why does this reaction between the vaccine and POTS occur? And what other side effects does COVID-19 have on the body? Well, subscribe to our channel and our newsletter on our website to stay updated for those answers, and read our full article on our website because it's all there for you. And if you've experienced any side effects from the COVID-19 vaccines, what do you think about the science showing this, and what were your thoughts about the rollout when it occurred? Let's start a discussion. I'd love to hear your stories because there are no silly questions at Bare Science.